Hello there. My name is Nicole Mason, and I am a psychiatric physician assistant. I've been in clinical practice since 2005. I have a Doctor of Medical Sciences degree from the University of Lynchburg, and I also have NCCPA certification in both general medicine and psychiatry. Today, we're going to be talking about prior authorizations, which are the bane of most medical practices' existence. So what is a prior authorization? A prior authorization is when a prescribing provider sends a prescription to the pharmacy, and the pharmacy goes to fill it and looks up what the insurance benefits are for it. And the insurance says, oh, no, we're not going to fill that until you contact us and we specifically approve this medicine. And so what that means then is that the pharmacy has to send back a request to the prescribing provider to fill out more information for the insurance before the insurance is willing to pay a portion, if not all, of that medicine. So what does that mean for you? That means, if the prescribing provider sent the medicine to the pharmacy, you can always pay for it out of pocket by cash. But as is in most of the cases, you want your insurance to pay all, if not some, of the cost of that medicine. You're going to want your provider to fill out the prior authorization. So what happens then is your provider fills out a list of paperwork, and that paperwork depends on the insurance company and what their specific requirements for each drug is. So we're not going to get into that today. And then from there, the insurance company will say either that you meet criteria and approve the drug and whatever co-pays for that drug that you have to pay, or co-insurance. Or B, they'll say, nope, you didn't meet the criteria. Either choose an alternative or do this to meet the criteria. Now, the good news is that for most generic medicines, so I work in psychiatry, so we'll use some psychiatry examples. Escitalopram, which is the generic for Lexapro, typically won't need a prior authorization by insurances because it's a generic medicine. Manufacturers make it pretty cheap, and you can buy it for pretty cheap. So most, in general, insurances won't require a prior authorization for that medicine. Now, however, that's not true for all insurances. There are several medications on, say, Medicaid, for example, that do require authorizations for generic medicines, and not only just for the medicine, but for each dose change. Another thing to take into account is that when you're doing prior authorizations, typically the prior authorization process can last somewhere between 7 and 10 days. Sometimes, though, especially depending on the insurance and the medicine that is looking to be approved, it can take 30 to 45 days before finally all the paperwork has been submitted to the satisfaction of the insurance company. So for generic medicines, again, the patient can always go to the pharmacy and pay for it out of pocket, but generally it's going to be really cost prohibitive to do something like that. So they're going to want the provider to fill out the prior authorizations. Where I work at Pine Ridge Mental Health Care, we have a team that works on those prior authorizations with the provider to try to get that approved. Now, what will happen in the unfortunate event that your insurance says, no, you don't meet the criteria, you have to choose another, or do this to meet the criteria, you'll then meet again with your provider and they'll go over the determination from the insurance company, and you'll decide a couple of things. Then you'll decide to either appeal it. So sometimes that happens, especially when it was denied for superfluous reasons. Okay, so for example, once I had a peer-to-peer review at UHC, the psychiatrist there denied a medicine because they said that the patient hadn't received a course of mental health therapy yet. Well, the FDA guidelines did not report the requirement for a course of mental health therapy appointments. The UHC guidelines did not report the requirements for mental health therapy, but the physician denied it because this hadn't been done yet. And so it had to be taken to an outside appeal process in order to get it approved. Now, those are thankfully somewhat rare, but specific instances where you wouldn't want to then go through their criteria. You would just go to that outside review and appeal process. But for the most part, you're going to either have to choose a different drug that your insurance says is in their drug formulary, or do that in addition to working through the process of trying to meet their appeal criteria for the medication. And so your provider will meet with you and discuss the pros and cons of this new medicine that they're wanting you to try instead of the one that was prescribed, or detail what needs to be done in order to get the other medicine approved. And then it's up to you to work with your provider to decide what route is best for you. In the best case scenarios, the insurance company approves the medicine. And now we get into tiering of drugs. So there are typically 3 tiers of drugs: tier 1, tier 2, and tier 3. And your most expensive medicines are going to typically be in your tier 3. And so this means that for you, the patient, it's the highest out-of-pocket cost in order to get that medicine. So it's been approved. The insurance will pay their portion, but you're still going to have a much higher cost than, say, a tier 1, which is typically going to be a generic drug that doesn't need a prior authorization process in the first place. So that's just a little bit today about the prior authorization process that insurances go through. It's a difficult but doable process, and if you just stick with your provider to try to get through it, most of the time it can be successful. If not in the beginning, then at least eventually. If you have any questions, please comment below. If you liked this podcast, please like the button as well. Thank you so much for joining me today.